But this is another initiative that WHO is doing. Again, this is our infant mortality rate globally is remarkably high. It's dismal in the United States. We are number 47, if you didn't know that, in infant mortality. And we believe, the WHO believes, that one of the missing links is empowering the moms to understand the top danger signs after they deliver for mom and baby. And so we went out to the world and we spoke with moms and grandmas, and they absolutely wanted more information. So we have gone out to these countries and Boise, Idaho. I've made that a new country. And we have actually focus grouped the refugee population in Boise, Idaho. But we've brought moms together and we've asked them, how do we empower you? How do we activate you to help identify danger signs in you and your baby? And then what to do about it. And so we've coupled this. The moms have helped us draw pictures, recreate pictures that speak to them, because not all moms read. And then we also coupled that with cell phone technology. So they'll get reminders on their cell phones, because 89% of the world has access to a cell phone. To when they identify danger signs, to call a number. There's this interactive voice response kind of messaging where the mom can determine if this is an emergency, and in some cases they believe they'll be able to, from that cell phone technology, dispatch emergency medical systems. So this is in production right now. This was actually made for the developing world, but if we look at our own world here in the United States, we need this. If 83% of the moms in the United States don't know that jaundice can cause brain damage, we need to inform our moms, empower our moms. Imagine as employers what you could do for the mother-baby population by empowering and informing your moms and dads. So the last example of patient engagement that I want to share is what Lucian brought up. Bringing patients into governance, into hospital systems, into the redesign of our healthcare system. And patient-centered care enjoys lots of different definitions, and people kind of define it however it best fits them. Marty and I, traveling around the world, have had the opportunity to really understand from patients what do they think patient-centered care is. And it's really not the smell of chocolate chip cookies when you walk onto the maternity ward, or being happy, or your food, or the design of the building. It's really about not designing the healthcare system for the patient, but designing the healthcare system with the patient. That is patient-centered care. And so, like Marty said, my journey has come full circle. I've been around the world. We've ridden camels in Egypt, we've been in Indonesia, we've been in Latin America. But I have really taken a hiatus the last couple years to be home with my kids. But I can't sit still, I guess. So the hospital where Cal was born and injured, and the hospital and I had a very adversarial, very ugly relationship for a decade. And I decided it was time to approach them, basically because Modern Healthcare was going to interview them about Cal and me. So I said, it's time. You know, it's time that we set the history aside, that we take our collective hard-won knowledge, our passion, and do what's right for our community, and bring in patients into their decision-making, into their redesign, to make it smarter, leaner, wiser, better ROI. And so I didn't hear from the hospital after my request to speak to the board for a while, and then I finally heard from the chief medical officer, who invited me in 2 years ago, and we envisioned this Patient Family Safety and Partnership Council, which is kind of tipping the model on its head. Many of the hospitals right now do have patient family advisory councils. I think advisory is not strong enough, and so that's why we would like to tip the model on its head and start with safety and quality rather than arriving at safety and quality. So we have gone through 2 years of planning, which really means 2 years of getting leadership on board. And we envision there's Idaho, that their councils will be partnerships with patients and families to improve patient safety and the quality of their experience at St. Luke's. They're system-wide. Our aim is to have zero harm, incorporate active patient and family engagement throughout the St. Luke system to contribute to safe, quality, patient-centered healthcare. We envision patients on all of the safety committees. We envision patients doing rounds with governance. We envision board members to be on our patient and family safety councils and vice versa. We envision patients helping create patient safety material, testing the messages. We envision patients being involved in creating a reporting system within that hospital for unsafe or near misses, or when there is a safety event, they need to report that somewhere in the hospital. We envision patients being involved in when there is a bad outcome or when there is an error, they need to be involved in the RCA or whatever investigation that takes place, because without the patient's perspective, the RCA, the investigation, is incomplete.